Good morning, everybody. How are you today? Tess Crawley here, clinical and forensic psychologist and director of Dr. Tess Crawley and Associates. If you've not seen me and my posts before, well, welcome to your first video, if it's a first of mine. We are at day 89 of my 90-day vlog challenge. So roughly 90 days ago, there have been a couple of days where I've not posted against my perfectionistic tendencies because I've either had some internet problems or some other reason. But generally speaking, about 90 days ago, I started this vlog challenge as a means of communicating more regularly and more frequently with our community around issues to do with psychology. And today I am posting, if you're not sure what I'm actually doing, I'm sharing into our other groups because I've got some closed Facebook groups which might suit you, and I'll talk about those in a little bit. You might wish to join some of those, and they give you a forum to talk a little bit more privately or comment a little bit more privately without your Facebook friends and family knowing what you're doing and saying. But I'm posting today because we've got, you might have seen my ad yesterday, well, my video yesterday, which was an ad. We're looking for more psychologists and social workers, mental health accredited social workers in Launceston, our Launceston office. So we've got a head office here in Hobart, and our head office hasn't always been in the location that we're in, but we started the Dr. Tess Crawley and Associates practice nearly 10 years ago. We're getting very close to our 10th anniversary in Hobart. Prior to that, I was a sole practitioner working out of the rooms of other professionals. I was with some speech pathologists for a while and things like that. And I've worked in lots of other settings, but that's a story for another day. So we're looking for new clinicians. And so, of course, that got me thinking, well, of course, that does mean that the reason we're looking for new clinicians in Launceston is we've got a number of clinicians who are moving. So a little bit of a backstory. We opened our Launceston office on the 1st of July last year. And we had some psychologists and a social worker who joined us when we opened, and very shortly thereafter, well, within about 5 months thereafter, they left the practice to go and start their own private practices. So of course we had a lot of clients who needed some backup and support during that period of time. So two of my fabulous Hobart-based clinicians offered to travel every week to Launceston to support Catherine, who is our full-time psychologist in Launceston, and to, of course, to provide support to our Launceston clients and our rural outreach clients from Georgetown and Scottsdale. So they've been doing that for the past year, and it's really time for them to come home and to stop having to drive so much. So we've got those two clinicians relocating back to Hobart permanently. One of them is sadly leaving us, and the other is going to remain in our Hobart practice. We also, more recently this year or earlier this year, we have a mental health accredited social worker who joined our team in Launceston, Belinda, and she's with us a couple of days a week in Launceston. And we've got a new psychologist called Lydia who's starting with us in January full-time, alongside Catherine being full-time as well. She's a provisional psychologist. She's finished a master's in professional psychology and is doing what they call a +1 year, which is a year of supervised practice before she can be fully registered as a psychologist. But she's actually got quite a bit of interesting experience under her belt. So she's, as my granddad would say, she's not as green as she is cabbage looking. And I'm sorry, Lydia, if that sounds like an offensive analogy, but that's the sort of thing my granddad would have said. Okay, so with all those staffing movements, of course, we've also got Kath in Launceston, who she's in an interesting position. She's relocating to Hobart to become my principal psychologist to help take over some of the responsibilities that I have for leading the clinical team, to help me free up some time to do some other things within the practice. And she will still have a caseload, and she will still occasionally travel to Launceston. So Launceston's technically losing Kath, not Catherine. Kath and Catherine, we've got them both in Launceston. So Kath will still manage a caseload, and we're just in the middle of figuring out how that's going to look. Hi, Donna. Thanks for being here with me today. So we've got lots of clients in the process of transitioning to new clinicians, and it got me thinking that, of course, a lot of people don't know how this is handled when there's a change of psychologist or social worker or other allied health professional. How do we go about having a new psychologist manage your care? And I'll use, forgive me for always saying psychologist, as you know I am one, and so it just rolls off the tongue, but I'm mentioning psychologist and saying allied health professional is what I mean. I'm trying to be inclusive. So what we do, sorry, I still haven't finished sharing into my groups, I'll get into trouble with some of them. So what we do when we have, I'll talk about it from your perspective if you're a client of ours or any other practice. So if you're going to be changing psychologist, what's the best way to do this? Well, sometimes it's due to you, something that you want. So you might decide that you would like a change in therapist, and this is something that not a lot of clients understand that they have the power to do. You are well within your rights at any time to decide that you're just not clicking with your therapist. You might feel like, you've told them a lot of personal information, they've offered you lots of strategies to move forward, and it's just not working for you. So some people think, oh, well, then psychology is not any good for me. I tried it, it was no good. Therapy is no good. Think about it in terms of a hairdresser. If you didn't like your hairdresser, if you didn't like the way your hairdresser cut your hair, would you never get your hair cut again? Of course not. You'd find another hairdresser. You'd find someone that you could be relaxed with, someone that you could chat with, and someone who you trusted to do the right thing with your head. Okay, cutting your hair, making you look good, making you feel good when you walked out of that salon. So having a psychologist it's even more important, because we're dealing not just with a hairstyle, we're dealing with your mental health. It's important to have the right fit. So from your perspective, if you feel that you're not getting that right click happening between you and your psychologist or mental health professional, have a chat with them and say, look, I'm just feeling stuck, or I'm feeling like this isn't quite working for me, this feels really awkward, but I think I need to be referred on to somebody else who's perhaps more, you might feel that you'd be better with someone closer to your own age or someone older than you, or you might feel that you'd respond better to working with a male rather than working with a female, or you might feel better working with someone who's a parent as opposed to not a parent. There's lots of reasons that people have for changing therapists, and they're all valid because it's your therapy, it's your choice. You're allowed to drive that. So that's when a client wants to change therapists. But what about when the therapist is leaving the practice or leaving their job? So I used to work in the prison a long time ago, and I'm sure you can imagine prison work's quite intense, and so there tends to be a fairly high turnover of staff within the prison setting. And I remember one day meeting a new client he was new to me, he wasn't new to the prison, he'd been there for a very long time and he had a very long time to go. And he said to me, very cynically, oh yeah, okay, so you're my new psychologist, are you? Yeah, the last one lasted, about 12 months? How long are you staying for? And, it wasn't a great way to start the conversation, but he was right. I think I worked in the prison setting for at least a couple of years, 2 or 3 years, I can't remember off the top of my head now, but that was unusual. There was a high turnover of professionals working in that prison setting, and so the long-term inmates were used to people just coming and going in and out of their lives and not staying very long. So there was that big hurdle of trust to get over before you could get anywhere near doing any kind of meaningful therapy with people in that situation. So sometimes I would talk to them about, change of therapist isn't what's important. What's important is your progress. Are you making progress? And sometimes you need to be the one driving that. The therapist isn't the driver of your progress. The therapist is the one providing you with some tools and some tricks and strategies, some techniques. So you can think about it in the sense of you're driving the car, but the therapist is the navigator holding the map. Somebody else could hold a different map and you can still get there in the same you know, the same shape, as long as you don't crash the car along the way. So I really encourage people to think of it that way, that the therapist doesn't hold all the power. You hold the power. You hold the expertness in you. You're the expert of you, not the therapist. So some people feel frightened that when their therapist is leaving their job or moving to a different place or a different location, sometimes they're nervous that, how will I cope on my own? So there can be a little bit of separation anxiety, which is really understandable, especially if you've been working together for a while and that you've shared lots and lots of information with your therapist that is of a highly personal nature. So oftentimes, and I do say oftentimes, and I mean oftentimes, you know, our clients tell us things they've never told another soul ever. So you know, it can be really confronting to then have to pardon me, have this sense of starting again with somebody fresh. And that feeling, got a frog in my throat, that feeling of having to start fresh can be quite anxiety producing. So when you know that your therapist is leaving their role or moving to a different place, then the conversation to have is, what can we do to help my new therapist start from a good footing? What does my new therapist need to know ahead of time to help me feel more secure? So some icebreakers, if you like, for your new therapist. So it might be that you have a traumatic childhood history. Now your new therapist might not have the capacity to read mountains and mountains and mountains of documentation before they see you. They'll certainly go through your file notes if it's within the same organisation, of course. So within our practice, when there's a change of therapist, the case notes we store all electronically. So they're all in our practice management software system, so the new therapist can see those notes, get an overview of what the history's been for you. And I encourage all my clinicians, when they're changing, when they're leaving, that they leave in the client's file in our software system, they leave a plan. So this is where we've got to, this is what we need to do next. And you can also say, these are the things I really want to not have to tell my new person. These are the things I would really like them to know ahead of time. So you can make sure you have that conversation with your departing clinician before you start with your new one. Now, the other thing that's really quite valuable in working with, when there's a change of practitioner or a change of psychologist, is to remember that sometimes being starting a new therapeutic relationship with a new clinician can have the benefit of a brand new set of eyes. So sometimes when we work really long term with particular clients, we get to a point where, looking at it from a different tack, your family, for example, might not notice when you've lost weight. You know that analogy? You know, friends that you haven't seen for ages will go, wow, look at you, or you've had a haircut, or wow, you look amazing. They'll notice things because they don't see you very often. But your family don't necessarily notice those things because they see you every day. So with a therapist, sometimes, not always, but sometimes over a really long time within a therapeutic relationship, you don't necessarily see some of those subtle shifts over time. Of course, we're always monitoring how you're traveling, and of course we're always monitoring, you know, what strategies are needed to help you get to the next level. But sometimes getting somebody with fresh eyes into your therapy can have the added benefit of new thoughts, new ideas, new perspectives, because of course, you know, two of us could assess you and come up with the same diagnosis, perhaps slightly different tangent on how we would approach that. So it can be really beneficial to have somebody new working with you. So it's not the new therapist or having the change of, having a new therapist that should be the focus. It really should be, how are we going to transition from therapist A to therapist B? So that's something I encourage my team to do, is make sure you're having conversations with your clients about these changes. Make sure you have a chat with them about what they'd like the new clinician to know, and make sure that you document in the client's file what the new clinician needs to know, but also where you got to with the therapy. Now, another reason why that's really important, and this is another benefit to having a change in clinician, is you might decide now's a time to perhaps have a little break from therapy. And it's okay to have breaks from therapy. Hollywood likes to tell us that therapy is something that you do every week forever. That's not real life. Okay. On average, we would see a client, and of course it varies, but on average we would see a client every 2 to 3 weeks. Okay, and it's not so much what goes on in the session that's of greatest benefit, it's what goes on between the sessions that is the biggest game changer with your progress. So if your clinician gives you some homework to do, some strategies to try, what's really important is that you then go home and play around with those strategies, try them, practice them, see what works, see what doesn't work, tweak them a little bit. And then at the next session, you talk to your therapist about how that went, what you want to try more of, what you didn't really like, and the therapist will come up with some either some strategies to ramp that up a bit or some new strategies for you to try on for size. So it's the work you do between sessions that is really, really important. So you might decide that you've learned a whole bunch of skills from your current psychologist and they're leaving, so perhaps now would be a good time for you to try going it on your own for a little while, and with the understanding that you can come back and start fresh with a new therapist when you're ready. So that's another thing for you to think about. When your therapist is leaving, again, it's that transition out of the relationship with that particular therapist that is important here. And if you've got a plan, your plan might be to have a break from therapy. Your plan might be to go it alone for a while and see what you can, how you can adapt all the things that you've learned and how you can generalize those new skills into other areas of your life. So you might find that actually it's a bit of a gift, to set you to take the training wheels off for a while and see how you go riding that bike by yourself. So, and of course, and again, speaking from our practice's perspective, if you're a client of ours and at any time you've been discharged or you've gone on your own and decided you don't need therapy for a while, or you've just said, look, I'll ring when I need something, at any time you ring up and you say, look, I used to be a client of, say, Lily's or Katie's in Launceston, and I know they're not there anymore. I've been doing all this stuff by myself for the last 3 or 6 months. It's been okay, but I'm just starting to feel that maybe I need some support again. Who do you think I should see? That's the conversation to have. Not a scary conversation. It's not saying, I've failed, I can't do it by myself. It's not that at all. It's saying, do you know what? I can see that things are heading in a direction where some help would be useful. Don't wait until it all falls apart at the seams. We'd rather get in and help you before that happens. So it's really beneficial to have an idea of how you keep an eye on how you're traveling. And when you start to feel that it's a little bit wobbly, or it's a little bit shaky, or the strategies aren't working as well as they used to, then give us a call and we'll let you know if you need a new referral. So sometimes you will, depending on how long it's been since you've seen us. But if it's not been too long, your referral might still be valid. And because it's still in-house within our practice, you can see one of our other clinicians without needing a new referral. But give us a call and we'll let you know whether or not that's what's needed. So I would like you all to have a think about, if you're one of our clients in Launceston and we've got new clinicians starting, we've got more coming, more new people coming. If you've been working with one of our team members who's on the verge of moving back to Hobart, then I want you to be thinking about, what does this mean for me? Does this mean was I halfway through something really monumental that I was working on that I need to keep progressing? Was I trialing some skills that I've been taught and looking at how they're going? Looks like they're going okay. Could I stretch my sessions out a little bit further? Could I have a gap in therapy and come back when I feel I need a top-up? Could I be open to the benefits of a new therapist being involved in my care? So have a think about it from all those perspectives that I've talked about. Now, the other thing to remember, and I can't stress this enough, our team, our whole team, so between Hobart, St Helens, Launceston, the whole east coast of Tasmania, we've got roughly about 15 clinicians on my team. So I'm really spoilt rotten for skilled people. I've got lots of skilled people. So it might be that you're based in Launceston or Scottsdale or Georgetown or St Helens or wherever you're based. It might be that you have a particular need that could be better addressed by someone based in our Hobart office. Now then we would have a conversation with you about how we might manage that with a mix of occasional face-to-face sessions and then ongoing these sorts of sessions in between. So you're watching these videos, you know that it's okay to sort of, have a feel that you kind of feel like you know what Tess is all about because you've seen me on this Facebook Live forum. We use Zoom, which is a platform a bit like Skype, but we find it a little bit easier to use than Skype, a bit more reliable and a bit more secure. But it's just like this. We just talk face to face, and your clinician would be here in Hobart and you would be in St Helens or wherever you might be, and you would have some of those sessions. Now we've got Launceston, Scottsdale, Georgetown, whole of the east coast of Tasmania. We've got our funding through Primary Health Tasmania to provide sessions by phone and online. And of course we've also got the backup of the new rural mental health funding under Medicare for online sessions, rebates under Medicare. So I would say to you, if you're facing the change in therapist, if you're in the middle of that process or you're in the middle of that conversation, try not to be anxious, try not to be scared. I know it's daunting. Change is daunting, isn't it? I mean, none of us really likes change, but sometimes change is necessary for circumstances outside of our control, and sometimes change is beneficial. So I'd like you to approach the situation from the perspective of, what, this might actually turn out to be good for me. I don't know that yet. Why don't I approach the situation with an open mind? So have a chat with your psychologist or your social worker or your mental health professional, whoever it is that you're working with, wherever you are, not just my clients. And if there's a process of change unfolding, it might be that they're going on maternity leave. If there's a process of change unfolding, have a conversation about the transition. How will we manage this transition? What can we put in place so that I feel safe and that I feel that my therapy can continue as and when I'm ready? So whether that's now with a new therapist or down the track with a new therapist, or in the case of a maternity leave situation, can I wait until they're back? So that's probably enough on that topic for me today. I've talked quite a bit. Do feel free to ask questions if you've got any questions on this topic. I know it can be tricky for people to handle change, and of course that's one of the things that we deal with as psychologists, is we're often helping people transition to all sorts of different things in their lives. So transition and adjustment to change is a big area for us to talk about. We're quite familiar with handling those kinds of issues, so have a chat to us if you feel that you need that little bit of extra support. Alrighty, that's it for me today. It's going to be another hot one in Hobart. I read today on the news though that hi Judy, welcome. We're just wrapping up, but this is a really useful topic, so you might want to watch the video again when I finished it off in a minute. We're sad news that we're having this lovely hot weather at the moment, but we may be in for a cold and wet summer, so we'll just hang on to the warm weather while you can. Go for a swim at the beach. We had whales in Hobart in the River Derwent yesterday, so we had a whale hanging around off Kingston Beach and Taroona Beach yesterday, and some people were lucky enough to be standing on some rocky outcrops in the water, and the whale was relatively close to them, which was really lovely for them. Not me, I wasn't there, sadly. Have a lovely day whatever you're doing. If you're whale watching, enjoy that. Please stay a safe distance away from these wonderful creatures. They really don't want you too close to them, especially if you're on a motorised vessel of some sort. And I will talk to you all again tomorrow. Enjoy your day. Bye-bye for now.